Central Valley Talk COVID edition. Have you been closed down? Have you been quarantining? Have you been staying home? Have you been sitting around watching election results, waiting to find out who the new president is? Well, life has to go on. There's a lot happening out there that you need to know is happening, especially if you're a senior over, I think, age 65, or if you're on, what is it called, Medicare? Yep. Our guest is an expert on all this, Paris Cluff. People on Medicare need to pay some attention right now. Is that right?
Absolutely.
What's going on?
It's called open enrollment, and it's open enrollment for Medicare Part C, which is Medicare Advantage, and Medicare Part D, as in David, which is prescription drugs. And so they have between now, it started October 15th, and December 7th is when it ends. And it gives, it's open enrollment for them to choose a plan for next year and make sure that they have the plan that they want going forward next year. So it's an important time for seniors to make sure that they're reviewing, they're comparing, and they're getting the plan that they need for next year.
So on December 8th, they can't say, oh yeah, I meant to switch my prescription plan because it's not working for me. It's too late to even look around then. It's done, right?
That's correct.
And December 7th, it's late to look around too, but that's the deadline?
That's the deadline, yeah. As long as they say that as long as we get the application in by midnight, okay, that on December 7th, it should be fine.
And Paris Cluff can get it in by midnight because he's wired into the system there. Yep. Now, some people may be getting these big medical bills that they don't need to have. They're just on the wrong plan?
So Medicare, if you just have Medicare all by itself, that's Part A, which services your hospital, anything you might do at a hospital, surgeries, things like that. And then Part B, and by the way, sorry, in Part A, there's a deductible. So if you don't have a medical insurance beyond Medicare, you're going to pay a deductible for a 60-day window to use the hospital. After that, you pay the deductible again. So it's the deductible is every 60 days, and it's about $1,400. Wow. So it can add up. And then Part B is for doctors, labs, x-rays, anything you do outside of the hospital with a normal doctor, or it's more outpatient stuff, and that's a 20% co-insurance. Wow. And those can add up fast if you don't have something to help subsidize that.
And then C and D, are those the ones up right now?
Yeah, so Medicare Advantage plans give you in Fresno, Madera, Kings, Tulare, all those counties. The Central Valley basically there's several companies in each of those counties. It's based on the county in which you live. So depending on what county you live in, there's a Medicare Advantage plan or several Medicare Advantage plans that will be in that area. And what we do is we sit down with seniors, and we make sure that, one, that their doctor takes the plan, and two, that all of their prescriptions are covered, because Medicare Advantage plans, the neat thing about them is that your prescription plan comes included. And so what's neat about Medicare Advantage plans is that it's like an all-in-one plan. It takes all of the Part A, the Part B, and the Part D benefits, combines them into one plan, and gives you one card, one plan, makes it really super easy and simple.
Now, if they already have all that and they don't do anything, they just continue as they were the year before.
So every year you just renew if you don't make any changes. Last year, Medicare allowed something called right now it's technically called annual election period. And they opened up what's called technically open enrollment period January, February, and March of next year. It was the first year that it's been back. It was several years ago they had it, and they did away with it, and they brought it back this last year. So if someone misses the deadline, let's say that someone misses the December 7th, comes and goes, oh no, it's December 8th or 9th, I should have called somebody. January 1st through March 31st, you have another opportunity to change, but once that change goes in, that's locked in for the rest of the year. So that's something that people don't know a lot about. They don't remember that January, February, March, they have that one-time opportunity to kind of get something going again. But that's something that I should let people know about.
So who should call you? Is it people who are worried that they're paying too high, or they may have to pay too high if the wrong thing happens? Who should be calling you right now?
Right now, there's a lot of commercials going on. There's commercials with Medicare. They're talking about all the different benefits that are available: dental benefits, vision benefits, hearing benefits. If you have Medicare, you have a Medicare Advantage plan, and you're not sure if you're getting the benefits that you want or need, then give me a call, and I'll make sure that you have all the benefits that you need. I just met with a client earlier today. We went through all of their prescriptions. We compared all the plans in town. We found out that they were still on the best plan for what they were doing. Another client that I met with earlier yesterday, we ended up that there was another plan that had better coverage for the things that she wanted to do with her health care next year. So we'll probably end up switching her to a new plan. So every year it's good to just see. Every company can come out with a new formulary for their prescriptions, or they come out with a new set of benefits. So anybody who really wants to make sure that they have the best plan for them for next year should give me a call, and I can do a review and a comparison for you.
Are you saying that if they just let it ride and let last year's plan ride, it may be different? They might have changed some things?
So every year from January, Medicare Advantage plans are from January 1st to December 31st. Every year a company can actually change the plan a little bit. So seniors will get every year what's called a notice of change, and that will let them know what's changed in their plan, if any of the co-pays have gone up, if any of the benefits have changed. There's a few plans in town in Fresno that have had a few changes, and so it's just important to look through that, make sure that you know what your plan is going to cover next year. And if you aren't sure, or if you need some help to kind of interpret, honestly, those books are thick, and they're usually written by lawyers and people that have a different level of understanding. And so if you want help interpreting or understanding, give me a call, and I'll be more than happy to go through what the benefits are for your plan. I represent all the plans in Fresno, and Tulare and Central Valley, Madera, Kings County. I'm all those counties, so anybody in any one of those counties can give me a call, and we can do a review and comparison.
I always compare myself to the guests. I have read 0 of those plans, and you've read a whole bunch of them.
Yeah.
So you have some great working knowledge. And by the way, I love Joe Namath. He's with the New York Jets. It's a commercial, but I will always call a local guy. I just think it's important to sit face to face or through a Zoom meeting or a phone call or something, and have somebody go over it for me. I would prefer.
Yeah,
that.
with COVID right now, we're doing a lot of digital enrollments, a lot of Zoom calls. I have a Zoom account, and I can sit down with the senior and help them, walk them through. There's a lot of electronic digital things that they do. And it's funny that you mentioned Joe Namath. And when you call an 800 number, usually you get an 800 number level of service.
Yeah.
When you call a local person, they're going to be able to, maybe even at some point, will hopefully be able to come to your house and visit with you. At least have the ability to communicate, and I can be an advocate for you to the plan. A lot of customer just called me this morning. She was frustrated about some things that were going on with the plan and the provider, and I was able to help advocate for her, and we're going to find some answers for her. And it's just nice to be able to have somebody that can do that for you.
Yeah, good. And nothing against Joe Namath or the Jets, but the Jets are 0-8 right now, not one win this season. So yeah, how do people reach you? I mean, I always tell people it's free to call Paris. It's free to call him, Paris Cluff, not the country Paris, but Paris Cluff. It's free to call him and find out. Just, hey, I just want to see my plan. I'm not sure what it is. And by the way, every day almost I get something in the mail from a company. Hey, we're changing your phone plan a little. We're changing your bank plan a little, your credit card plan a little. I'm not going to even catch if they've changed my plan or not. So I might call Paris Cluff and just say, hey, look this over for me.
Yeah, absolutely. I'd be more than happy to talk. You can reach me at the phone number that's listed on the screen right there. It's 559-825-1678. Leave a message. It's a very busy time of the year right now, so if I don't answer, please leave a message, and I promise I will get back to you. You could also go to Facebook. I have a Facebook. It's called at Paris Cluff Insurance. So there's not too many Paris Cluffs on Facebook, and if you type in the insurance part of it, you'll get my insurance page, and you'll be able to reach me there and message me as well, and I'll be happy to respond.
Very good. So it's time to do it. You have till December 7th, and get a hold of Paris or whoever you need to reach out to somebody. But Paris is an honest guy, a decent guy, and he's free. He's free to talk to. So,
absolutely.
Last thoughts for our viewers?
Just make sure that time flies. December 7th is going to be here, and before we know it. So please make sure to reach out to me or someone that you trust that can help you, give you the right advice, and help you compare the plans that you need to make sure that you have what you need for next year. There's some really good plans, too, for folks who have Medicare and Medi-Cal. Medi-Cal is a state-run plan that goes alongside Medicare. If you have Medicare and Medi-Cal, there's additional benefits that you can get. A lot of carriers like United Healthcare and other carriers in town have a lot of great benefits that they're offering for folks who have both of those cards. So if you have both of those cards, or someone that you know or love has both of those cards, give me a call as well, because we can make sure that you get the right benefits for what you're looking for. So those are my final thoughts.
I forgot you told me you have something special for people with Medicare and Medi-Cal. Got some special things for you guys. So call Paris and ask him about it.
Yep.
Call him at 559-825-1678. Thank you, Paris.
You bet. Thanks, Mike.
Maybe we'll have you back in a week or so because this is crunch time.
It is.
We'll be back with more Central Valley Talk right after this.